Hi, this is a typical patient journey of mine in clinic. So they develop some kind of a shoulder pain, which starts to go down into the arm, or hip and back pain, which starts to radiate down the leg. So it's typically labeled as sciatica, and the patient gets, usually in a week or two, gets to see the GP, and then the GP gives them naproxen, lansoprazole to protect the stomach, gives them a free referral to physiotherapy. A few weeks to a few months later, they get a telephone consultation with the physiotherapist and get some exercises. Several weeks to months later, they present at the clinic and they're worse. Sometimes the pains are migrating down the arm more, pins and needles, numbness, and down the leg more so. What's going on with this cohort of patients? Well, I've drawn a little diagram here for you. So if this is the two bones, and this is a tendon that spans between, a muscle and tendon that spans between the bones, if you take a biopsy of that, heat it up, remove all the water, 66% of that matter is water, that goes, 33% is dry mass. Out of that 33%, 25% is lectins, laminins, glucosaminoglycans, all that jazz. 75% of it, 93% of it is collagen type 1, and then the rest being collagen type 2s and 3s, mainly for what I deal with anyway. So in that state, when you start to get an injury, you start to get this cross fibering, this scarring going on within the tissue, and then you'll start to get a little bit of inflammation, which I've drawn in reds. What does that cause? That causes three things to that muscle and tendon. It loses its elasticity, its stretchability, that reduces. It reduces its power by up to 50%. And then it also becomes sluggish, so it takes longer to activate that muscle. With that going on, you're going to get weaker. So normal activity will feel like overactivity, and all the new vessel growth, including nerve vessel growth, is going to cause a lot of pain. So when initially you get that within the tendon, we call it tendonitis. When you get the tendon, as you see the blue lines, and this, the green being the bone, the blue being the tendon invaginates into the bone, and then that causes a bone bruise called periostitis. Peri means around, ost means bone, itis is inflammation of. So if it's within the tendon, it's tendonitis. If it's within the bone, it's periostitis. Usually happens within the first few weeks of an injury. Now, if you start to get a chronic injury beyond 12 weeks, then you get the tendon becomes tendinosis, and the bone bruise becomes periostosis. So that's here. And as you can see, I haven't drawn as many red marks here. You'll still get little bits, pockets of inflammation occurring. This is why in a chronic injury for days and weeks you can be okay, and then suddenly doing normal activity can overdo it and you get a flare up. And we call it acute on chronic. So you'll get a chronic scar fibering, which will build up a lot more than in this phase. But then within that, because it's less tensile, you'll get more tears in it, and then you'll get little inflammatory bursts of it. So in that stage, by the time you get to given the exercises, because our waiting lists are so long in NHS, then they start to give you these kind of exercises to do, right? For your shoulder, they'll give you some stabilizing exercises and hip exercises to do for your back and your hip. If you're in this phase, or you're in this phase, and you start to get given those exercises, your muscle is weaker. Your muscle is less elastic. Your muscle is more sluggish to activate. So what happens is sometimes compounds the injury and puts injury in other areas. This is why things then snowball. When you come to clinic, we sometimes chuckle with our patients, kind of give them an idea of what's been going on and say, right, let's do it in phases. Phase 1, we get hands-on. So with the scar tissue, let's remove it. Here, typically, I remove the scar tissue, the fibrosis, with needles into the tendon itself, and we improve the quality of the lining of the bone by bone needling. Then we start to help all the inflammation and start to get we start to help the inflammation typically with things like ultrasound. And then we start to reverse the type 2s and 3s back into type 1s. And then, of course, sometimes we do some stretching with our hands. We do some soft tissue techniques to try and stretch this very rigid type of fiber that now starts to form. And then slowly we start to, initially we don't give exercises because doing normal activity in an injured state is exercise enough. And then as they recover and get 20, 30, 40, 50, 60% better, then we pile on the exercises gradually. Thank you for watching.